Hello, my name is Dr. Sean McCorkle, and I am a veterinarian at Summer Creek Animal Clinic. And today I wanted to talk to you about deworming your cats. And so my assistant Lauren is going to help by asking some questions, and I hope this is educational and helpful for you to learn more about worms in your cats.
Dr. McCorkle, what are intestinal parasites?
Yeah, they are parasites that live and reproduce within the gastrointestinal tract of animals. And so there's many different kinds that affect dogs and cats, but that is the gist of it.
And how do intestinal parasites affect the health and well-being of my cat?
Yeah, that's the big question. So as your cat gets exposed to these worms and they start to colonize the intestinal tract, they're feeding inside the intestinal tract. And so depending on the type of worm, that can end up leading to significant diarrhea and dehydration, depending on the severity. And some of them even feed on the blood. And I've seen many patients over the years that have had severe, for example, hookworm infestations that can lead to anemia or a low red blood cell count. And I've even seen some pets in serious situations that have died from intestinal parasites as a result.
What preventative measures can be taken to ensure my cat doesn't get worms or other parasites?
Yeah, the really important things are to test your cat for intestinal parasites, which we'll talk a little bit more about, to ensure that you pick up the stool regularly. So clean your litter box at least once a day. That's going to help prevent transmission between cats and to help prevent your cat from continually getting reinfected. If your cat does have intestinal parasites, they absolutely need to be treated appropriately based on the type of intestinal parasite. And then having them on regular monthly broad spectrum parasite prevention, which oftentimes includes a dewormer, is really important to help reduce the worm burden and hopefully prevent them altogether.
And what are some signs and symptoms of intestinal parasites in my cat?
Yeah, that depends a lot on the type of parasite, but diarrhea is often, or soft stool is a common sign. They can be kind of what we call a poor doer, especially in a younger kitten where they're just not thriving. They may be underweight, and it's because of the intestinal parasite load, which tends to be more of a burden on those younger cats as well. And sometimes weight loss can be an issue if there's a big worm burden. And then, like I said earlier, an anemic situation can occur where their red blood cell count is low, and that can be extremely dangerous. And then one of the obvious signs is some of these parasites, you can see the adult worms as they come out of into the stool. And so sometimes you can get a really clear idea that, hey, there's an issue. Even if your cat is clinically normal, they can have intestinal parasites that are just kind of living in the intestinal tract, but not necessarily causing a serious issue at the moment. And those situations can be a little bit more insidious and cause problems over time.
How will a veterinarian diagnose intestinal parasites in my cat?
Yeah, so sometimes we can see the worms in the stool, and that can give us an idea of what the type of parasite there is, or at least that particular one. Oftentimes there's a couple different parasites. The most sensitive thing we can do is to run what's called a fecal test, where we take some of the fecal material and do specialized testing. Kind of the classic or old school, if you will, way of doing that is to float a sample in the clinic. That's becoming less and less common, although it's still done pretty commonly. We don't do that at our practice at Summer Creek Animal Clinic. We send the fecal samples off to the outside lab that we use because it's much more sensitive. They spin down the sample with a centrifuge that greatly increases the chance of identifying the parasites. And they actually even do additional what's called antigen testing on the feces now for a couple of the common parasites, which just means even if we can't find the eggs when they spin it down, they can identify the DNA in the feces of these parasites or I'm sorry, an antigen in the parasites that tells us that there are adults present, even if we're unable to identify the eggs. So sending off the fecal testing really allows us to be a lot more clear as to whether your cat has parasites, and that's extremely helpful.
What are some possible conditions caused by intestinal parasites, and what are the treatments?
Yeah, the obvious treatment is to deworm them, and there's several different dewormers we use, again depending on the type of parasite present. The conditions that can occur would be that intense diarrhea, vomiting, even in some cases, weight loss, anemia. So those secondary things that occur as a result of the parasites being present need to be managed. And in some cases that can be managed conservatively. And in other cases, has to be very aggressive, and sometimes even blood transfusions have to happen. And so it really depends on the individual condition of the cat. And that's why it's really important to have your cat evaluated by a veterinarian to make sure there's not anything else that needs to be done besides just the deworming.
And why is early detection and diagnosis of intestinal parasites so important?
Yeah, it's so much more helpful if we can identify parasites when they aren't causing a problem. So especially here in Fort Worth, Texas, it's common for us to find parasites in clinically normal dogs and cats. And that's the best time to find them. That's why we screen fecal testing one or two times a year, ideally twice a year, because we want to find those parasites before they're causing a problem so that we can treat them and hopefully get that under control. That's important because, as we've talked about, there can be serious fallout from having intestinal parasites if they get out of control. And at that point, we're dealing with a much more expensive, much more potentially dangerous situation for your pet. And not addressing things early does put other pets at risk. So part of this is thinking about the entire population of pets in the community and trying to reduce the exposure to these parasites. First and foremost with other pets in the household, but then also the entire community as well.
Thanks for that. And last question, when should my cat see a veterinarian for deworming?
As early as possible. So if you have a kitten so if you have a kitten from a very young age, they actually need to start deworming at 2 weeks of age, and then get dewormed every 2 weeks until they're started on broad spectrum parasite prevention, which is typically around 8 weeks. So you need to see your veterinarian as early as possible when you have a kitten, so y'all can work through those things. And if you have an adult cat that hasn't been to the veterinarian, again, establishing that relationship, having the feces tested, starting on broad spectrum parasite prevention that would include heartworms, fleas, ticks, intestinal parasites, is going to be the best way to approach that. So that's what I would recommend. And if you're in Fort Worth, we would love to help you at Summer Creek Animal Clinic. You can reach us at 817-523-1139. And our website has a lot more information as well at summercreekvet.com. And you can also book an appointment there. Thank you so much for joining us.